Opioids act as strong pain relievers. Some are used as medications, but they can also be produced or obtained illegally. They include codeine, oxycodone, hydromorphone, heroin, fentanyl, morphine, and carfentanil. The rate of individuals experiencing harm from opioids is on the rise in Canada. It's worrying that young people are included in this rate, and their wellness is being negatively impacted by opioid use. And the risk of death is also rising. These young people need care as unique as they are. They require specialized care matched to their individual needs and hopes. This specialized care takes time, but can help young people transform their lives. As a service provider working in the substance use field, your work is often demanding, sometimes overwhelming. There are many service providers who work together to transform the lives of young people experiencing harm due to opioid use. Collectively, these service providers form a youth network of care. You are part of this network of care, and even if you aren't sure how you fit in just yet, know there is potential, the potential to change lives. This video explores a way providers can give care to young people that fits their hopes and needs. It's about listening to them, building trust, and helping them on their journey to wellness and recovery. Opioids can cause euphoria, but what makes opioids so dangerous is that they are central nervous system depressants. This means they turn down signals between the brain and the body. This includes physical pain signals to the brain. But they also turn down other signals, like the ones that control breathing and heart rate. Overdose or opioid poisoning happens when these vital functions are turned down so much that they stop. This can result in brain injury or death. Overdose can happen the first time someone uses an opioid because there's no way to know what is too much. Opioids can be especially dangerous for young people because their brains are still growing and changing. Opioid use disorders result out of a pattern and escalation of use and consequences over time. A youth may need to be further assessed for an opioid use disorder using the DSM-5 Manual for Assessment and Diagnosis, which requires several criteria to be met. So imagine you're a young person who uses opioids. You're afraid, hesitant, unsure if you even need help. You might be worried your parents will find out. You might not know where to go for help or even have access to it. You feel stressed and lost. This can be scary for anyone, but especially for a young person. Now picture that same young person looking for treatment. On that journey, they are going to meet a lot of different service providers. Remember that network of care. Understanding where these youth are coming from can help shape your interactions with them, but you're going to need more than understanding to support them on their wellness journey. You need a unique approach, one that uses empathy to build trust and ultimately to empower the youth in your care. Let's say you're meeting the young person for the first time and you need to assess them or see where they're at. You've got a big list of questions. For some youth, seeing your clipboard with formal questions can be intimidating. Instead, start a simple conversation with them. Start off by asking about their daily life. How do they like to spend their time? What people are important to them? And what's happened to bring them here now for help? The next step in addressing their mental health is to find out what they're going through and how they really feel. Remember, mental health is a big part of substance use, so if you can't support them in this area, be sure to refer them to someone who can. Next, talk about their substance use. Ask about the drugs they're using, how often they use them, and when they started, and if they witnessed people using drugs at home or in the community. Try to get them to open up about the reasons behind their lived experiences. When you have these conversations, try to remember what it's like to be young. Try making a joke, chatting about hobbies, or even letting the young person teach you something. Find some common ground to really connect with them. Put them at ease. Over time, they will see that you really want to know who they are, that you understand their issues, that you hear them, and that you truly care. You'll have lots of these conversations. Be patient. Gradually, you will get to know this young person as they become more comfortable with you. Any service provider in the network of care can start these conversations with a young person looking for help. And remember that it's also important to refer the young person for formal screening for other mental health conditions. Working with young people also means working with their families or caregivers. You play an important role in educating their family, helping them find the right services, and teaching them how to support the young person. This is a specialized approach to caring for and working with young people who use opioids. Remember, start with respect and empathy to build trust. Remember these 3 areas. First, talk to them about their daily life. Second, their mental health. And third, their experiences with substance use. And work with their family or caregivers to help them support the young person. As part of their network of care, you can bring positive change to a young person's life. You can inspire and empower them and help them reach their potential on their wellness journey. For more information about opioids and supporting youth who use opioids, please visit the link below.